Our experiment looked at the effects of carrying position, walking direction, and intentional trunk rotation on risk of trunk injury, as well as movement speed and stability while carrying a litter or slat stretcher. A litter is most commonly described as a portable stretcher without vertical support or wheels, and is carried by 2 or more rescuers to retrieve victims in emergency situations where there are obstacles hindering the safety or movement of the patient and responders. Litters are used by emergency personnel and soldiers to quickly and effectively transport victims. The carrier can either be in the lead or follow position. The main goal when carrying a litter is to transport a victim as quickly and safely as possible while simultaneously keeping both the victim and the carrier safe. The primary purpose of the current experiment was to determine which carrying methods resulted in the safest, quickest, and most stable way for a rescue personnel to carry a patient lying on a stretcher for the carrier. Stretcher loading and handling are the most physically demanding components of an EMS call. This is simply because the most time is spent performing these movements. So cumulatively, low back load is the greatest during loading and handling. More than a third of injuries during stretcher handling are lower back strains to the EMS carrier. A potential explanation for such a high risk of lower back strains during stretcher handling is related to increased trunk flexion, making the back extensor muscles more susceptible to fatigue. Another explanation for the high risk of lower back strains during stretcher handling is related to increased rotation of the trunk during backwards carrying. In a study by Maras et al. 1998, the researchers identified that twisting of the trunk increased the force moment about the trunk, more so than lateral bending in both sagittal upright and sagittal flexed conditions. Emmerich et al. 2005 discovered that at slower gait speeds, young and middle-aged, able-bodied individuals had increased sagittal plane trunk flexion and extension. There are multiple ways to carry a litter, however, it is not clear which method of carrying is best for the carrier and the victim. Our study sought to determine which method of carrying is safest, most stable, and fastest in terms of trunk flexion, gait speed, and double support time. Trunk flexion is most important for carrier safety, while gait speed and double support time are important for victim safety. Related to carrying position, we examined differences in trunk flexion, gait speed, and time and double support while in the lead or follow position. Similarly, we examined the differences while walking both forward and backward in the lead position. Finally, we looked at differences with and without the presence of trunk rotation while walking backward in the lead position. We conducted an experiment and used motion capture technology to collect data at 120 Hz. Our subject was Selena, a 22-year-old average female. We had Selena complete 4 different carrying conditions. We had her walk at a comfortable pace forward in the lead position, forward in the follow position, backward in the lead position, and then backward in the lead position where she looked over one shoulder. Each condition was repeated 3 times. So when comparing walking position, we had the participant walk in the forward direction with either the weight of the litter in front or behind. With this condition, the participant was always in front of the litter. The participant either walked in the forward direction with the weight behind her or in the backward direction with the weight in front of her. In the final condition, we had the participant always walk in the backward direction. The only thing to change was whether or not the participant looked over their shoulder to see where they were going. In order to do this, the participant had to rotate their trunk in the frontal plane to look behind them. When looking at gait velocity, only one significant result was observed. Walking in the forward direction with the litter in front resulted in higher gait speeds than any other condition. Comparing the other walking conditions shows no observable difference in gait speed. Stability was measured by the percentage of time spent in double support during the gait cycle. An increase in double support time results in greater stability because of the larger base of support. The experiment found that walking position and walking direction impacted double support time more than walking with a twist did. Furthermore, walking direction in the lead position resulted in the largest amount of time spent in double support. Therefore, walking forward in the lead position was the most stable carrying method. Although this difference is not large, it could be the difference between falling and not with an injured person in the litter. The final results compare the angle of forward trunk flexion between the 3 conditions described earlier. Almost no change in trunk angle was observed between the first conditions, which were walking forward with the litter in front of or behind the participant. This result suggests that when analyzing thorax angle, both conditions are equally safe. Carrying position only had a minor impact on flexion of the trunk. However, forward trunk flexion nearly increased by 50% during backward walking compared to forward walking. The increase in trunk flexion has been related to increased risk of back injury to the carrier. These results in isolation suggest walking backward is more risky and should be avoided if carrying somebody on a litter. Additionally, forward trunk flexion doubled again in backward walking with a twist compared to regular backward walking. Based on these data, the trunk flexes the most during backward walking, especially with a twist. Walking forward in either the lead or follow position provides the smallest amount of injury risk for the carrier. This is due to the decrease in trunk flexion seen when walking forward compared to walking backward. Because increased trunk flexion is associated with a higher risk of injury, walking backward with the presence of trunk rotation poses the greatest risk to the safety of the carrier in terms of risk of low back strain, and therefore should be avoided at all costs. Regardless of the walking direction of the lead carrier, the carrier in the follow position should be the one setting the pace due to the increase in gait speed seen when walking forward. This increase in gait speed will help to ensure that the victim gets to medical treatment as quickly as possible, although this increase in speed does come at a cost. When looking at stability, walking forward in the follow position had a decreased double support time, indicating that there is a small trade-off between walking speed and stability. This means that when rushing to transport the victim, the carrier in this position must be conscious to not walk too quickly, or else they could have a large decrease in stability, which could be harmful to the victim. Walking forward in the lead position was found to be the most stable due to the longest time spent in double support. This means that if walking over uneven terrain, or if there is a potential of falling, the carrier should walk forward. Otherwise, there is a larger risk that the carrier could fall and potentially harm the victim as a result. Walking backward in the forward position should be avoided at all costs if possible, as it resulted in the shortest amount of time spent in double support. In this condition, there is a higher risk that the carrier might fall, which could cause further harm to the victim or the carrier. In an emergency situation when time is of the utmost importance, both carriers should walk forward. For both carriers, walking forward had the smallest amount of trunk flexion and the fastest gait speed without any major decline in stability. This means that walking forward for each carrier is not only safer for the carrier due to the decreased risk of injury, but also for the victim, as they can move at a faster pace without becoming unstable. A limitation of this study was that we only examined the effects of carrying position, walking direction, and trunk rotation while walking on a flat surface. Further research should be conducted on the effects of different terrain or navigating obstacles such as stairs in order to determine if a different set of carrying conditions would be best in other situations. Thank you for watching. We hope this was insightful. We would like to thank Dr. Gross, our wonderful TAs, Riley and Jackie, Jay Krems, Stefan and the Groundworks team, and the endless support of our colleagues in Move Sci 413. Thank you.
Thank you so much, Dr. Gross, for helping us out.
Oh, it's just so challenging. It is actually challenging.